Good morning, and thank you for joining us for the City of Lubbock COVID-19 News Conference. My name is Lacey Nobles, and it's been a while. We're so glad you could join us today. Today, our panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, and Mayor Pro Tem Steve Massengale. So let's get started with Catherine Wells.
Thank you, Lacey. Just hello. It's been about 3 weeks since we've last met, and things around COVID are really getting better. Our guidelines are becoming a lot less restrictive over the last 2 weeks. The CDC has released new guidance on masking and masking requirements, saying that it is safe for anybody who is fully vaccinated to not wear masks, even in some more crowded situations. The data out there is showing that the vaccines are just as effective as they were in the initial studies, and this is such good news for the community. As things get better, I want everyone to be assured that the health department continues to be dedicated to following COVID-19, just as we work with any other communicable disease. Over the next 6 months, we'll continue to still have extra staff to answer phones, assist with contact tracing, help individuals and families who are affected by COVID. It is important for everybody to go ahead and get that vaccine. There is lots of vaccine available in the community and lots of places to get it. So I encourage everyone to get vaccinated. When the governor issued his latest executive order, he said that the Lone Star State continues to defeat COVID-19 through the use of widely available vaccines, therapeutic drugs, and safe practices utilized by Texans in our community. And it's so important that we pay attention to that message because it mentions that it's the vaccines and those safe practices that are keeping us safe. And we all need to work and go and get that vaccine. Over the next couple of weeks or throughout the summer, you're going to see the health department in lots of different areas. Our whole summer is going to be focused on getting vaccines out into the community. We will have 2 outreach teams out in the community. One's going to focus more on giving vaccines here at the health department, and the other one's going to be focused on outreach events. Last weekend, we were at the YWCA offering vaccine at the Truck to Trunk food distribution site. We gave over 100 vaccines as a drive-through clinic. This Saturday, we'll be at the South Plains Mall, right next to Barnes & Noble, giving vaccine to anybody age 12 and over who's at the mall. We'll also be partnering with LISD to offer clinics at some of their high schools over the summer. We'll be sending out press releases, our Facebook page, the city website will have all of those different events. There's lots of vaccine in the community, no excuse not to get it. We can give it to anybody that's 12 and over now. With that, I will pass it on to Dr. Cook.
Thank you, Catherine. And I agree with Catherine. Our numbers are getting lower. We see that every day. We see that in our hospitals. Our numbers are getting much, much better. I'm really pleased that our numbers are staying low and that people are getting out and frequenting our businesses and eating out and going to stores and those sorts of things. That really does help our local businesses. As mentioned, as Catherine mentioned, our hospitals are staying low as far as COVID numbers are concerned. But what I want you to hear today, one of the things I want you to hear today is COVID is still present in our community. We haven't wiped it out completely yet. We still have a number of positive patients that come down with COVID every day. We also have a number of hospitalized patients. We're still in the 20s of patients that are sick enough with COVID to be in the hospital. And some of those are in the ICU. They're sick enough to be in the ICU. COVID has not left our community. It's still causing illness and sickness and hospitalizations in our community. And the way we get to zero is by getting vaccinated. We can wipe out this virus if you get vaccinated. 43% of Lubbock has had at least 1 dose of the vaccine, and that has significantly contributed to our decrease in numbers. And those over 65, even a majority of those have been vaccinated and fully vaccinated. And so that's why our hospital numbers have significantly improved. So get out and get your vaccine. You're going to hear that over and over today. I'm sure you've heard that Pfizer has lowered their age group to now 12. Catherine just mentioned that. So anybody 12 and up can get the vaccine, Pfizer vaccine. I expect Moderna and Johnson & Johnson to do the same thing in the next few days. And so in Moderna, I heard on the news this morning that Moderna is 100% effective in their 12 and up age group. That's fantastic news. And so I expect Johnson & Johnson will give us their number soon. So soon we'll have 3 vaccines for everybody that's 12 and older to get their vaccine. They're already doing numbers for 5 through 12 or 7 through 12. So ages 7 through 12 are next. I expect that to be out in the next month or so. And then the next age group is 2 through 5. So I think by the next several months, certainly by the end of the year, any child that's older than the age of 2 to get vaccinated. Right now, we're at 12 and up within a couple of weeks, probably 7 and up, and then we'll keep going down from there. Expect that children will have the same side effect profile as you did when you got your vaccine: a sore arm, some low-grade fevers, some muscle aches, some lethargy, but that should last less than 24 hours. These are very, very safe vaccines. Why would you vaccinate your child? Is because they get sick too. They could give it to somebody else that is much more vulnerable or prone to severe disease. And that's the main reason why we do that. Get those kids vaccinated. They can also develop what we call multi-system inflammatory disease, and that causes severe disease in some certain children. They're hospitalized, lots of inflammation. Even 300 deaths have been reported nationwide with children and COVID. So get your child vaccinated when the age is appropriate for them to get vaccinated. Most of all, let's get vaccinated so we can wipe out this disease. We are tired of wearing masks, and I'm tired of the anxiety about, am I going to give it to somebody? If I catch it, how sick am I going to get? The best way to do that is to get vaccinated. Also, please continue to wash your hands. And so let's everybody get vaccinated so we can get rid of masks and wipe out COVID in our community. That's all that I have today. Blessings, friends. Let me hand this off to Mr. Massingale.
Thank you, Dr. Cook and Catherine. Good morning, everybody. It is great to be back with you today. I'm going to start, as we always do, with our data set. Mayor sends his regrets. He had a conflict on his schedule today. Let's go ahead and get my screen shared here. Okay. Hopefully everybody can hear me. This is our first slide. You're accustomed to seeing this. This has shown that our hospitalization rate has been low and consistent. This is where in December, this is what we longed for, and we've seen that has stayed low, and that is a positive thing since late February. This reinforces Dr. Cook's comments that there is still COVID in the community. There are still people that are sick with COVID. This is data from the last 14 days, so you can see how important that is. Lastly, this is our vaccine slide. This shows first and second doses. I think the takeaway on this one is the fact that we are decreasing those that are the number that have been vaccinated, and it just shows how important vaccines are. So if you haven't had your vaccine, there's plenty there. There's plenty out there for you. Okay, let's see if I can get back live here. Okay. Let me start with, just on behalf of the mayor and the council, just sending condolences out to those people that have lost loved ones, people that are currently sick, and those people that have had their businesses and livelihoods affected by COVID. We know that there has been significant impact. Our first press conference was Tuesday, March 3rd, 2020, regarding COVID. We've had 60 press conferences since then. Today is our 61st. Prior to our first case of COVID, our health department has always stood ready and been prepared for pandemic response. Since that first press conference, we've done everything we can to make sure that we're communicating with up-to-date information and to provide all the necessary information to keep the public safe from COVID-19. I want to thank several groups today, especially our Lubbock Health Department. You, our local media partners, have been with us the entire way, our healthcare community, local, state, and federal elected officials, our school districts that locked arms with us in this effort, our business community, nonprofits, and many civic organizations, Texas Tech, and all of our institutions of higher learning. It was impressive how we all came together to fight the pandemic. During the mayor's initial press conference and his first emergency declaration, he said, "We are entering uncharted waters," and I believe that proved to be abundantly true. Our news conferences worked hard to provide information and access to healthcare experts, open a dialogue with the public, the media, and others in our community. The information in the beginning was changing by the hour, and we were aware of that. We worked hard to make sure that our statistics and all the data was published on our website. I know that working through the pandemic was not without frustration and concern, and good, valuable information we felt was important so that you could make your own decisions around public health. As the vaccine became available, Lubbock did a great job. As you know, we were ranked as one of the third best cities in the United States for delivering the most vaccines. Our hats are off to our health department, our first responders, our staff at the Civic Center for building one of the most efficient vaccination clinics in the country. So we're not out of this. This is not an announcement that the pandemic is over, but we will tell you at this point there will be no more scheduled press conferences. We'll continue to update our dashboard Monday through Friday. There'll be no more press releases unless there's a need. I would stress this to you, how important it is to get your vaccine. The vaccine makes all the difference. Yesterday in City Council work session, we got an update on sales tax, and the March numbers were remarkable. And that is all due to the confidence that the vaccine builds. And so we look forward to that. We've always been concerned for our economy and make sure we made decisions to uphold our great economy out here in West Texas. So to close, I would just wish everybody a very safe Memorial Day. And with that, I will turn it back over to Lacey for Q&A.
Thank you, Mayor Pro Tem. We're going to open it up for our media questioning now. And here's the order for today's questions. Sarah Self-Walbrook, Christy Martinez-Garcia, Mateo Rosales, Olga Aguero, Terry Furman, Grace Morris, Karen McKay, and Matt Dotre. So let's get started with Sarah Self-Walbrook with Texas Tech Public Media.
Hello, everyone. Both of my questions today. Oh, can y'all hear me okay?
Yep.
Yes, ma'am.
Okay, just making sure. Both of my questions today are advice as we kind of navigate this next phase of the pandemic. So Dr. Cook and Catherine, what advice do y'all have for households where some members are vaccinated, but for whatever reason, maybe a kid who's not eligible yet, not everyone in the household is vaccinated? How much can people in these situations loosen up with masking and some of the other preventative measures we've all gotten so used to in the past year?
I think the CDC, Sarah, that's a great question. I think the CDC does continue to give us good guidance. I think for the most part, if you're in the household and they're already living in the household and they're not, you don't have a lot of traffic coming in and out, masks are, the conservative side of masks may be needed, but for the most part, if they're living in the same household, then no masks are needed. I think if you go out in the community though, and those individuals are not vaccinated, then they need to wear a mask.
Good deal. And then my second question, what can citizens do to encourage their friends and loved ones who are still hesitant to get vaccinated? How can we encourage those folks to get their shot?
Example is I got vaccinated in trust among peers to do so and show that they've not had any significant side effects, and trust the science. Trust the science. The science solidly says that these vaccines are safe and they do a good job. No other vaccine in the history that we've ever had 95% effectiveness, and now we've heard that Moderna in the ages 12 through 17 is 100%. That's fantastic.
And I'm going to echo what Dr. Cook said. It's really important to tell people that you're vaccinated. Let people know that you got vaccinated so that they see that it's safe and effective. I think the more people that you realize that your friends, colleagues, members of your church have gotten vaccinated, that really changes people's mindset. For those people that, are concerned about the vaccine, if they see their friends have gotten vaccinated, that really does help them make that decision.
Yeah, I'll echo those comments. Lead by example, share your story, whether you've had COVID or not, and that you've gotten vaccinated.
Good deal. Thank y'all.
Thank you, Sarah. Now move on to Christy Martinez Garcia with Latino Lubbock.
Good morning, everybody. Great to see you all.
Good morning.
Vaccines truly do make a difference. And too often, I think many folks in this area don't believe that children in our community got COVID, can get COVID, or even die of it. But as you know, and I hate to use another personal experience, but after 6 losses to COVID and our youngest family member was 7 years old, it really does impact families in this area. And so, my first question, Dr. Cook, allergies seem to be more problematic this year, and a lot of folks still can't differentiate allergies and COVID. And how can you help them to understand that, what symptoms that they should think about that is just not allergies that they're experiencing, but could potentially be COVID?
Thank you, Christine. Sorry to hear about your loss. Six people, 6 family members is huge, especially in one family. So sorry about your loss. We continue to raise those people up for you. The main difference, sometimes it is very hard to tell between allergies and COVID. Allergies can make you feel pretty bad, but COVID can certainly make you feel worse. The high fevers, more lower respiratory stuff, eventually it turns in. And typically allergies don't really make you lose taste and smell. You might have a stuffy nose and not smell as well, but certainly one of the key features is anosmia, or the lack of smell. And some people, that's all they have. They may not have other symptoms, no other allergy symptoms, but that's more likely COVID. If you're concerned at all, we have plenty opportunities for those individuals to get tested. It's much better to be safe than sorry.
Absolutely. Thank you. Catherine, I know that there's still a lot of misconceptions about the vaccines. You've probably seen some of the TikTok videos that showed the magnet and on the skin. How are you overcoming those messages, those misinformed messages that are probably creating hurdles for folks that need to get vaccinated?
That's really a multi-tiered steps. I mean, there are state advertising and public service messages going out, but us locally at the health department, it's about having staff trained to be able to answer those questions and really be out in the community to talk to individuals. And when we're out there doing vaccination clinics, like we'll be out at the mall this weekend on Saturday, we'll have staff there actually giving vaccines, but I will have staff throughout the mall giving information about the vaccine, being able to answer those questions. So I really encourage individuals who are on the fence about it, have concerns, please reach out to the health department, your provider. We can answer those questions.
Catherine, I do have to ask you also, if someone still wants to host a vaccine clinic at their event or their business, is that still possible?
Yes, we have one empty Saturday still in June and still looking to book July. So please reach out to the health department. You can call my desk personally, and I'll have one of our staff get that arranged.
Thank you so much. Have a great day, everybody.
Thank you.
Thank you, Christy. Now we have Mateo Rosales with the Daily Toreador.
Good morning. I only have one question for y'all today. With 43% of the city of Lubbock being vaccinated with the first dose, some citizens are concerned about getting a second dose because of the side effects they had with the first dose. What do you have to say to these citizens that are afraid of getting the second dose?
Thanks, Mateo. You know, the efficacy that we see with Moderna and Pfizer to get to 95% effective rate on the vaccines, you have to get the second dose. That's the best place to be. Usually the side effects, some people are completely asymptomatic and some people have significant side effects. And you can take Tylenol with those. We don't recommend that you pre-medicate, but after a couple of hours, you could take some medicine for it and see. And the side effects are very short-lived, 24 hours. 24 hours.
Thank you.
Mm-hmm. Thanks, Mateo.
Thank you. Now, I don't see Olga on with El Editor, so if she signs on, we'll get back to her. So now we move on to Terry Furman with KOBK.
Good morning, everybody. So glad that we've reached this point in our pandemic that we've seen. My question is probably for either Catherine or Dr. Cook. I'd like to know the numbers for people in the hospital. They're kind of staying between the high teens and mid 20s. So my question is this: when, oh my gosh, my brain just let go. Okay. The people that we do have in the hospitals right now, are those because of lack of vaccine?
We have no indication, Terry, that I don't know what their vaccination I don't know what their vaccination status was when they were hospitalized. More than likely, those individuals had never received any vaccine. And it wasn't because at this point, most individuals get that sick to be hospitalized within 10 days or so after contracting the virus, 10 to 14 days. So we've had plenty of vaccine in our community for a number of weeks. So it's more likely that they've never been vaccinated or didn't get the second shot.
Okay, good deal. And my follow-up question is probably for Steve. In the past year, what has this pandemic really taught us about the people of Lubbock?
It's a good question, Terry. I mean, I think it has tested the character of our community, and I think we scored very, very high. I mean, it just seemed like when we were under the high stress levels and trying to address the needs, trying to balance protecting our economy and protecting our healthcare resources, everyone always came to the table. I mean, and it was remarkable. I mean, we just always, if we needed to have an audience with somebody, some group to get something accomplished, it happened. And so, I'm proud of what we did. I'm proud of how we attacked it, and I'm proud of where we landed.
Agreed. Thank you all.
You bet. Thanks, Terry.
Okay. Now we have Grace Morris with KMAC.
Hello, everyone. Good to see you all again. My first question here is obviously, masks are not really being worn around the city, which is a good thing. But is there any situation or place in Lubbock right now where you would still recommend wearing a mask out in public?
I can.
Okay, go ahead.
Yeah. We still need to wear masks on transportation. That's a place where we are in close quarters, and that's one of the mandates with transportation. I would also consider mask wearing whenever you're in a very crowded area and there's either high-risk individuals or you don't know the vaccination status of other people. So crowded inside is kind of where I'm personally wearing a mask or would recommend it still.
And certainly if you're not vaccinated in those
Yes.
environments, and if you're not, as Catherine said, if you're high risk and been vaccinated, but you're in that environment where close quarters, inside, and unknown vaccination status to the rest of the people, then certainly those individuals should wear a mask.
Thank you. And the second question, there's been some discussion about a COVID booster shot may be needed in the coming months or years or so. Is there currently any plan in place for maybe the Civic Center offering vaccinations again, if that booster shot is something that we need?
We would definitely look at how that booster shot, who it's recommended for, what its availability is. Is there a lot of it available so we can have it in every doctor's office and pharmacy in town? Or is it something where we need to stand up the Civic Center again? There's still things unknown about how this pandemic's on the progress. We're confident things are looking good. But if something were to change, we'll have a press conference again and we're able to stand up those city resources.
Thank you, guys.
Thank you. Now move to Karen McKay with KCBD. Karen, you have a question? Okay, we'll come back to her, see if she has a question. We'll now move to Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone. Ms. Walls, can you just kind of talk about, so it looks like vaccines are obviously slowing down, people getting vaccinated. Has it slowed down pretty significantly since the health department closed its mass clinic at the Civic Center?
Part of it. However, vaccines now available at United, at our chain pharmacies, at our doctor's offices. So the reason for closing the Civic Center was that we didn't have that need anymore. It's available in so many other places, and we're not seeing people access vaccine at those different, at the pharmacy where it should be very easy to go. You can go to the grocery store and get vaccinated at the same time.
Mm-hmm. Is the health department set up at the Mahon Library? I know that was a discussion a while ago. Or are you just giving vaccines at the health department now?
We're doing both. So we, throughout the month of May, we are at the Mahon Library 2 days a week to make sure we caught up with second doses of who was at the Civic Center. And then we're focusing on clinics throughout the community. We will be at LASD. We're going to be at Broadway Church of Christ. We're going to be at South Crest Baptist Church, different events. We're going to do a pop-up Saturday street party here in front of the health department with one of our farmers markets. So lots of things are in the works, and that vaccine should be available to anybody. If you go into any store or come to the health department today, you can get vaccinated.
Mm-hmm. And are you in communications with all the school districts? Kind of tell me what happens when, young kids can get the vaccine. I mean, are nurses going to be giving the vaccine at schools, or are you all going to be kind of hosting school pop-up clinics?
Well, what we're doing is we're partnering with the school districts. With Lubbock Independent ISD, they were able to send the forms home to parents. Parents could sign and say whether or not their child could be vaccinated. And then we actually gave the vaccine to the school nurses. The school nurses administered vaccine to those kids who had consent forms during the school day. And that seemed to work really well. We've done that twice with LISD, and we're looking to do that with some of our other school districts.
Okay, very good. Okay, thank you all so much. I appreciate it.
Matt, I will go back to Karen McKay with KCBD. Karen, can you unmute, please?
Can you hear me now?
Yes, ma'am.
Can you hear me now?
Yes.
60
can
news
hear you.
conferences, and I think I've had trouble for 40 out of those 60 news conferences. Probably a good thing this is the last one.
It's okay.
But I want to ask you, after 60 news conferences, it's been all about reaching herd immunity. And this news conference, we haven't heard a word about that. So is that still an issue? Are we there yet? Or have we decided it's impossible to reach because it's a national issue? What's the situation?
Aaron, it's a great question. We are not, our community is not at herd immunity. The best guess that we have is 43%. You know, we used to lead the state in vaccinations, but we have kind of fallen off. We're at 43% of all adults, all eligible individuals have received at least one dose. We need all those individuals have received one dose to get a second dose. And then we changed the denominator, the bottom number, when we added ages 12 through 17. So that brought our percentage number down. What's hard to account for is how many people actually had COVID that were not tested. And so that have some immunity that are out in the community that either they didn't know that they had the disease because they had very mild symptoms. That's very kind of common in some of the younger age groups, but that does play some influence because our COVID numbers are falling despite the number of vaccinated individuals. But we can't count those numbers because we don't have any way to test those individuals. Ideally, you would test every individual in Lubbock to see how much they had. So the only number that we can go on is our percentage of actual documented doses of the vaccine given. And that's why we still continue to urge individuals to come out and get your second dose, get your first dose. And if you only want one dose and only one needle stick, Johnson & Johnson, we have plenty of vaccine available. We knew that we would get to this point. You know, early on was such a rush, but now we have an abundance of vaccine. Even Pfizer changed their refrigeration requirements, making the shelf life even longer. So we have plenty of vaccine. That's why we're encouraging everybody to get it. We, like you said, we still have patients that are still in the hospital and patients that are still very sick with COVID. And to make that go away, we still need to get everybody vaccinated.
But Dr. Cook, is it even possible to reach herd immunity across the South Plains in our area when there's so much going on at the state and nationally? Is it possible for us to reach it locally?
Some states have already reached 70%. Why can't we? That's what I would say. We could do it if we can get people out to get their vaccine.
Okay, thank you.
Okay.
Thank you, Karen. Thank you to our panelists and to our interpreter. And thank you all for joining us today and for throughout the past 14 months. Remember, if you need the latest news from the city, please follow our social media sites or pick your favorite media partner because they get our news as well. In the meantime, have a wonderful and safe Memorial Day weekend.
Go get your vaccine.